features here. You see the superior vena cava, the aortic arch, the pulmonary trunk, the right auricle, and the left auricle. And then from the posterior aspect, you can see the pulmonary veins, and then you see the branches coming off of the aorta, the brachiocephalic, left common carotid, and the left subclavian. And then here you actually see the split between the pulmonary arteries. So those are the great vessels. As far as the coronary circulation, you have the anterior interventricular artery and the circumflex artery that are branching off of the left coronary artery. Right? Here you have the right coronary artery that's going to make its way around and give rise to these marginal branches. Right? If we look at the posterior aspect, oh, that's wrong. Here's your coronary sinus, posterior interventricular artery, and middle cardiac vein. Right? And then once all the veins drain into this coronary sinus, you dump right back into the right atrium. And this guy here is the inferior vena cava. If we open this guy up, once you open it up, you see the 4 chambers. So you have the right atrium, the left atrium, which are your receiving chambers. You have your atrioventricular valves, which are going to separate those chambers. So this would be the tricuspid. Here's your bicuspid. And then below the valves, you would see the ventricles. Right ventricle, left ventricle. This is your interventricular septum. Here, this represents the white little bands that you see here, represent the chordae tendineae, and those anchor to those papillary muscles. What else is visible here? The muscular ridges that you see within the ventricles are the trabeculae carni. And then in the right atria, you would have muscular ridges as well, known as the pectinate muscles. Right? So these would be the pectinate muscles in that right atrium. And then finally, the last few valves to recall, on the right side, coming off of the right ventricle, you have the pulmonary semilunar valve as you go into the pulmonary trunk. And then from the left ventricle, making your way up to the aortic arch, you would see the aortic semilunar valves here as well. So those are going to be those valves there. And I believe that is the anatomy of the heart.